I've received so many letters of encouragement and support and emails and text messages, and people have reached out to me, and some people have even actually sent money, and I'm thankful. The news on my dog is not too great right now. I'm coming back to get him. I guess this lady wants to amputate my dog's leg if I don't have. We'll see.
Hello.
Hello.
You're back. All right, I'm gonna get you in a room to talk with the doctor. All righty. Take you back.
Oh,
She'll be right in.
thank you. So I guess we'll find out how much money they want to save the dog's leg. Other than that, I guess they're gonna want to cut his leg off. Son of a bitch. Um, Normally I have a lot to say. But today I just think that when things happen, I mean, they just happen.
Hello.
Hello.
Okay, so we have some interesting findings. Okay, so well, we're still waiting on the radiologist report, but so it does not appear to have any kind of spinal injuries, which is good. All of his ribs are intact. His internal organs look okay. His bladder was intact as well. So what we're mainly concerned about is this is him on his back, obviously. This is him with his hip is obviously dislocated, but it's also very, very shallow, so it may actually not have been in place to begin with. And what happens here is basically the joint cartilage just kind of wears away. He's actually got a little bit of arthritic changes there as well. So what we would recommend, first of all, if we're not going to do the amputation, then he needs what's called an FHO, femoral head ostectomy. So that's the ball and socket joint. We would actually remove that ball part. And over time, this actually forms kind of a false fibrous joint. And he's a little guy, so they actually do really, really well with this procedure. Now, the only other problem is that's not the only injury to the knee, to the leg. He has, this kneecap is actually, normally it stays in place like this in a little groove. The kneecap normally doesn't move. it's actually moving sideways back and forth because it's not stable enough. And the lower part of his leg is actually swinging like a pendulum. You know, knees normally only go back and forth. His goes side to side.
I saw that.
Yeah, so that's another issue. So if you're going to try to repair that, that would require repair of the cruciate ligament most likely, as well as stabilization of the kneecap. So this is all potentially pretty expensive here.
This dog walks 8 miles a day.
Yeah. So he's
after
strong.
this,
He's
will he walk again?
Yes, it's going to take a couple months of therapy and healing time. You know, basically, little dogs do great with these procedures, but he would heal much faster, and it would probably be in much less discomfort with the amputation. So I got a couple of estimates together for you. One with the repair of the FHO and also the repair of the knee, and then the other is for an amputation.
Well, he's not going to walk 5 miles a day with that amputation.
Dogs do great on 3 legs. He's got a lot of muscle. He's a strong little dude. So dogs adapt very, very well. Basically, he already is 3-legged right now. So you know, it's a much faster recovery with the amputation, and also it's going to be considerably less expensive.
How much is it going to be?
Let me get you the estimates for you. So what I'd like you to do is just completely rest him. So either get a crate or just block off a really small area, lots of padding, make sure he can't fall off or go downstairs or anything like that. Take him out to the bathroom to go on a leash only. Don't let him run around, because if he's on meds and he's feeling better, he's going to try to take off. And you know, the Jack Russell temperament is it's the little man thing. They do not know how small they are.
Yeah.
So it's super important to keep them confined as much as possible. So then I'd like you to recheck him with Dr. Lori. She's the one who does our orthopedic surgeries on Tuesday, just to follow up and see how he's.
He'll be okay for the weekend, like he is.
Yeah, no, just again restrict his activity. Most of the time, you know, especially when they're feeling like this, he's probably not going to want to do a whole lot. But just make sure you go back on a leash and then straight back into confinement.
Is he going to be able to kneel down or am I going to have to hold him?
To go to the bathroom?
Yeah.
No, he should be able to. I mean, he should be able to balance on his left leg.
Okay.
It feels pretty solid. And like I said, I didn't see any obvious fractures or anything like that. I didn't feel anything unstable except at the knee joint. And like I said, it's not supposed to go sideways. So that was very, very abnormal there. So I'll get the estimates together for you there. And then the pelvis looked okay, spine looked okay, neck looked okay. And like I
How
said,
old is this dog?
At a guess, I'd say probably around 6, just checking his teeth and his eyes and all of that. So he's not very old. So he's got quite a few years left potentially. So, but let me get the estimates for you. Let me get this a copy of X-rays for you as well. These can be viewed on any computer, Apple or PC.
Thank you.
Yeah, and then we'll send him home with an anti-inflammatory medication that you'll start tomorrow morning. Also an antibiotic, because he's got some deep bite wounds in the back of the thigh where somebody got hold of him, obviously, and it went right into the muscle. But there's the X-rays.
Thank you.
Okay, and back with the estimates. Okay.
Yes, ma'am.
All right, just a minute. He's a good little guy. He may still be a little sleepy tonight, so just let him take it easy. It's not a bad thing if he rests.
Yes, ma'am.
All right, so this feels like eating dinner. Go ahead and start this tonight. Otherwise, wait until tomorrow morning, which is perfectly fine. This is the pain medication. Then he had an injection earlier, so he won't need this until tomorrow. It's a liquid, and let's see. Probably easier just to do the smaller syringe. It is dosed by weight. So the tip of this syringe will fit into the tip of the bottle. So hold it upside down and just kind of pull up what you need. Let's see. So right at the 17-pound mark.
Understood.
Yeah, so it's pretty easy to give.
Yeah.
Just give it slowly in the corner of his mouth so he doesn't choke on it. Be sure he's got some food in his stomach though, because it's like aspirin with people. You don't want him getting a tummy upset.
Okay.
And just kind of give it slowly so he doesn't choke.
Okay.
And that's going to be once a day starting tomorrow morning.
Yes,
and then
ma'am.
those you can start as well. Like I said, if he eats dinner, you can go ahead and start them. Otherwise, wait till tomorrow morning. And we grab the estimates for you.
Yes, ma'am.
And he'll meet you in a minute. So now, some of these numbers may change depending on what they find when they get in there, because sometimes you look at the knee and it just absolutely is destroyed. So these are approximate. The amputation, let's see, this is basically with any surgery we recommend pre-anesthetic lab work. We don't require it for a young dog, but we do recommend it just because we don't know his history or anything like that. So that's the blood work and the CBC. An EKG is a measurement of the electrical activity of the heart. It just kind of tells us, whether it's healthy enough to undergo anesthesia. Generally, if they're young and healthy, they sound fine. They don't have any kind of murmurs or anything like that. No arrhythmias. We don't require it, but again, it's one of those things that we recommend. He will have an IV catheter, we just place it into his arm, and that gives us instant access to his bloodstream, so we can run fluids while he's under, maintain his blood pressure. That way, if he needs any medications, we can give them right away. So the fluids are part of that as well. Hospitalizations, because he's going to need some aftercare once he's out of surgery. Propofol is the anesthetic agent that we use to sedate him, to get him under anesthesia, and we use an anesthetic gas to maintain him. So depending on how long the surgery takes, there may be some additional time on there. Generally, we do a local block just because it's a painful procedure if it's not done, and that gives him a few extra hours of comfort where he's not aware of anything going on, basically. So by the time he wakes up, he really shouldn't feel anything. Then, of course, we use a sterile suture while he's under, and then an antibiotic injection before as well as after surgery to help prevent any infection. Probably will need some more pain medication and antibiotics to go home with. And the bite knot collar it's kind of like a little bit one of those cervical collars that people wear when they have neck injuries. It just keeps him from turning his head and getting to his
We call
neck.
it the cone of shame.
Yeah, basically, it's kind of like So this is, the rough estimate for what it would cost for the amputation.
$2,000.
Something like that, yeah. And then this is, again, a very rough estimate because I'm not the one who does the orthopedic procedures.
$4,000.
Right, and this is if we repair that hip, repair the knee as well as do the FHO. Now the FHO is where we remove that ball socket joint. And then the CCL repair, the cranial cruciate ligament, is where you repair the ligament that keeps the knee from doing this. And that's what we're getting a lot of right now. Because the knee joint is kind of like that. The cruciate ligament is an X-shape like this, and it prevents looseness as well as rotation. And basically, in his case, it's just destroyed right now, I think. So that's why it's...
Was that a bite that did that?
Probably, or, he could have had some injury before, because it feels like it's kind of gritty, which means like it's been like that for a while. And looking at that hip joint, I suspect that hip's been abnormal for a long time as well.
Well, how's he been able to run on it and all this stuff?
Yeah, he's got 3 strong legs, so they compensate very well. And
he doesn't limp.
Yeah, well, that's amazing, but it's just
So Dr. Lori's going to do the surgery?
Dr. Lori is the one who does our orthopedic surgery, so I would like you to recheck with her on Tuesday. She'll be back on then, and she will have access to his X-rays and his history and all of that stuff, and just like to see how he's doing, if he's showing any improvement with the meds, but then strict rest until then.
How long will his recovery be when you, if you replace his leg? If you
do
fix the
the
leg.
knee and hip surgery, generally with little dogs, 4 to 6 weeks. But the problem, most of the time they're walking by 2 weeks, and the hard part is actually keeping them quiet. So but little dogs do great with these things because again, they're a 3-legged dog with a spare, basically, and they heal pretty quickly. And I suspect you'll feel a lot better, once that knee is stabilized. But so she, like I said, just follow up with Dr. Lori on Tuesday. Okay.
Yes, ma'am.
And again, the estimate may change, but that's kind of roughly where.
What, 20%, 10%, 15%?
I don't know. I tried to go high so that we're not going to be too surprised, hopefully. And we may downgrade some of those by the time we get in there, depending on what we find. Yeah, he seems to be healthy otherwise. He's a strong little guy.
He's very, very healthy. He's very fit.
Well, which is good. So we need to think of a good name for him. We can't keep calling him a
I
name.
think he's going to be called Warrior or something like that.
Something like that, yeah, seriously. After all this.
He fought so valiantly today.
Poor guy. How big was the other dog?
The other dog was like bigger than a German Shepherd.
Wow. Okay,
there were 2 dogs. He fought 2 dogs.
It's the terrier temperament. He just doesn't know how small he is. So,
well, he found out today, damn it.
No, they don't learn. They don't remember.
Oh, they don't learn?
No.
Oh, we got to do this again?
I hope not. All right, we'll meet you outside. Sorry.
Hi. How are you doing?
How are you doing? Oh, I'm sorry. So have. Where are you Lori on Tuesday?
On Tuesday.
How you doing, Winston?
He doesn't know.
He's
like,
away
I'm
from
here.
you. That's all I knew. Oh, man.
Recheck with Dr. Lori.
And Lisa just found out there. Have you seen any magnets?
I know Nicole had them yesterday. Oh. Let's see. So Dr. Lori's here from 9 to 2 next Tuesday. What time works best for you?
All done.
Or are we
9.
9?
Oh. Well, have fun.
Well,
Or are we dropping off? Let me ask her.
I think it's a consult.
It's a consult?
That's what I think.
Okay.
Yeah, double check. Hey, you. How are you, little man? Or woman? What is he? A little man? Winston. You know your name? How are you? Oh, good to meet you, sir. You good?
So we're gonna do an appointment.
Good. Does he no splint on him?
No.
I think we're gonna
They
determine
cleaned
that
it out.
after the appointment with Dr. Lori.
Here you go,
The
sir.
orthopedic. So let's see. We can do a 9 because this one is.
What about 10?
We can do 10. Yeah, 10 works. She has a 9.